we are live, Frederickson Health Show, with a very special guest, John Cancelino from Elevation Medical. He's here today to talk the ins and out of acoustic sound wave therapy and what it can do for you for chronic pain. So, John, thank you so much for coming on today.
Thank you for having me. Appreciate it.
Awesome. So you've been in this industry for a while, and when we were searching for our acoustic sound wave therapy, you were so insightful, so knowledgeable about the research, and I don't just jump on anything unless there's a lot of data behind it. But I want you to just kind of introduce yourself, how you got into this field, and we'll try to talk a little bit about the history of shockwave or acoustic sound wave therapy and how it can impact people's health.
Okay, yeah, for sure, I can do that. So yeah, I've been in the medical device industry for going on about 4.5 years now, but I've been in sales in general for almost 20 years now. And sales wasn't an avenue I thought I was going to be in. I didn't realize that I was actually a relationship builder that turned into being a good salesperson. So I don't really focus on just trying to get a sale and move on to the next one. I'm really more about the education and following up and customer service side of it. So it's actually paid off. But I've been in the medical device sales, as I said, for about 4 years, and I've been with the current company, Elevation USA, which is a subsidiary of Elevation GmbH, which is out of Germany. So our corporate headquarters is here in the U.S. In Duluth, Georgia. And then our world headquarters is actually located in Germany. Our CEO is in Germany. All of our research, all of our case studies and technology comes out of Germany. It's originally manufactured in Germany at Richard Wolf, which is pretty well known in the medical industry for everything from lithotripsies to robotic surgical equipment. And it really started out as surgical equipment for endoscopes and in surgery applications. And from there, it kind of branched out, and the actual German government oversees and regulates some of the manufacturing of the product, and they do everything in-house in Germany.
That's cool. That's awesome. So what is, if no one knows what we're talking about today, what is shockwave therapy or acoustic sound wave therapy? Yeah, as we know and call it, and how did it first get started? What were some of the first clinical applications for this type of device?
Yeah, for sure. I can answer those questions. So shockwave therapy is technically the same umbrella as acoustic wave therapy. Most people know shockwave therapy here in the US. They realize when they hear shockwave, they think of a radial shockwave device, which is produced by a mechanical force used by anything from electromagnetic or hydroelectric, causing a percussion and then sending a sound wave into the tissue in a radiating fashion, covering all the tissue equally. Our device is the only direct focused acoustic compression therapy device on the market, and it uses piezoelectric crystals. So the device is electrically charges the crystals. The crystals expand, and when they expand, they bang together, causing a sound wave to travel in a perfect formation based off of the ergonomics of the therapy source to a precise location in the tissue. So shockwave originally came to the U.S. for the podiatry market. They used to have a huge device. It was called an oscillotron that was a large machine that you wouldn't be able to carry around. And they actually brought it here for podiatry to break up, plantar fasciitis and bone spurs. But the problem is it was so powerful and painful that they would have to sedate patients. So over time, they realized that there was a better way for it. But it all really started in Germany. So any reputable shockwave or acoustic wave manufacturer is based out of Germany. And they found, after treating kidney stones, they were finding people were getting relief from pain when they were blasting their kidney stones in their hips or their back, and they were finding that it was going in and breaking up scar tissues. Sorry for my puppy to come say hi.
No worries. Cute puppy.
Yeah.
Golden doodle, right?
Yes, sir.
The golden doodle. Yeah.
Yeah.
So breaking up kidney stones, that's crazy. So are you saying this has the potential to break up bone spurs,
Yeah.
And
Yeah, so they can actually go in and small bone fragments, bone spurs, things like that. Osteoblasts, osteocytes that form from stress fractures. It sends in the sound waves, and what it does is it softens up those bone fractures, bone spurs, and remodels them at the cellular level, at the tissue, whatever the tissue you're treating, whether it's bone, musculoskeletal tissue, or even ligaments.
That's so cool. That's, when I first heard about shockwave therapy, I guess when I was in chiropractic school, it was always about, plantar fasciitis and heel spurs and melting away heel spurs. And there's been a ton of data and clinical applications for that, right? And that's kind of where we are today, from my understanding. And so, it's nothing short of amazing that we use it in our clinic, and, patients who have these debilitating chronic injuries. Hey, we're on a live TV. You want to come on? My son's got his dinosaur here. This kind of looks like a shockwave applicator, right? Something like that.
Exactly.
Say hi, buddy. So anyways, yeah, so for anyone listening, this has the power, to go where your hands can't go. And so that's the amazingness of this technology. And so, of course, the professional teams are following suit, and people are using it for a wide range of things. But can we talk about just some of the most common clinical applications that you see, John, in all the offices that you visit currently?
Yeah, absolutely. So we work, our largest market is the chiropractic market. Obviously, because chiropractors are working a lot with focusing on the musculoskeletal issues, and also they're thinking outside the box because this is a competitive market. So they're adding different tools to the toolbox to either broaden their actual clinical treatments, or to also get better patient outcomes. So our largest market is chiropractic, and then it would go to physical therapy, massage therapy. We also work with athletic trainers and sports teams as well. And then it goes over to the men's health side, which is the off-label side of it.
Right. And so as far as, because when I go to chiropractic trade shows, there's all kinds of new technology. There's always the newest, greatest gadget. But when I was looking in the research for the PiezoWave from Elevation, man, there is a lot of clinical research behind it. I mean, how many papers do you think you have over just this?
Yeah, so for our device specifically, I know we have at least a good solid dozen clinical research for our specific technology. Now we could get quite a bit more, but all of it's going to be all out of Germany. That's where they're doing the most of the research. But a lot of the research that you can find online has already been done for us. So we don't really need to invest unless if somebody's or schools, universities are doing more research. But we actually have a lot of people adding to our research side of it that are offering to do research because they find the benefits of the technology. And a lot of clinicians are doing their own research and writing papers. But the overall Shockwave, there's a lot of research out there for it, and a lot of it's been done. And the upside is it's been done for us already. The downside is they don't really specify what product they use to do it. Focused is always going to be the actual applicator to get this research, and then they just kind of generalize it as Shockwave. So Focus always gets the best results, and there's only 3 manufacturers of a focused Shockwave out there, and we are one.
So anyone listening who doesn't know what focused or radial is, it's a different applicator. So that's what we use in our machine in Georgetown, Texas, and so that's what the majority of the research is, from my understanding. But radial is, you can explain it better, more pulsatile frequency. You need to use usually some numbing cream for that, and it's not as extensive as a treatment as a focused or linear type treatment. Am I saying that right, John?
Yeah, absolutely. So the radial device is exactly that. The most energy is delivered at the surface of the tissue, and then when it hits, it radiates out in a fanning fashion. With ours, it comes to a precise point in depth and location in the tissue. So you're working on the specific injured tissue. With ours, it is quite a bit different as well because it's a diagnostic and a therapeutic device. So what it does is when you're passing over healthy, hydrated tissue, the patient doesn't feel anything at all. And then when you find this dysfunctional tissue, the fibrous tissue, the dehydrated, calcification, scar tissue, it gives a dull, achy feeling. So the patient knows you found that spot that they're having the issue with, and it basically mimics the path of pain that they have. So it's a good indicator for where the scar tissue is, and then you hover over that area to actually soften up or remodel or break up that dysfunctional tissue. With the radial device, it addresses the healthy tissue and the dehydrated tissue both the same. There's no different indication of feeling for the patient. It all just kind of feels uncomfortable. And you are correct that in most cases you do need a topical numbing agent for that, because it can be a little more painful, and it's quite a bit louder as well.
Right. So that's interesting. I didn't know that about radial, that you didn't find, you didn't know, you just treated the area that you thought was dysfunctional. But yeah, you're right. When we use the Shockwave with the focus, with the PiezoWave in our office, yeah, you can tell, and patients can feel it when you're on an injured spot that's dysfunctional. It's got some scar tissue. Maybe you've had a previous injury or two there, versus healthy, hydrated tissue. And you can feel it. And if you just move over just a little, the tiniest, little millimeter, tiniest little angle makes, the biggest difference. And it's so cool because when the patient feels that, when you feel that, you're like, hey, I'm on that spot. We're in the right area. Let's let healing begin. Because I know some other modalities, you don't really feel anything. You just kind of have to trust that process. But with the acoustic sound wave therapy in the focused manner, you feel it and you know that you're getting the benefit. And so I know a lot of people get scared of pain, but I'm all about productive pain. Mm-hmm. If you're in an area that's producing a little bit of pain production, I kind of feel like that's sometimes good. And so I describe it as a deep toothache. Would you agree? That's kind of what
Absolutely.
it feels like.
Yeah, that's a great description. It feels like a deep toothache, or if you're pushing on a bruise, it's something that you don't want to go on the whole day, but you could deal with it for a few minutes. With this, obviously, it doesn't need to be a full, several minutes. Generally, when you find a location, that dull, deep ache is generally about 35 to 45 seconds, sometimes maybe a minute, and it dissipates down. But you are correct. It's pretty unique in the way that you don't feel anything. Then when you find this dysfunctional tissue, the patient knows right away that you found it. So it is a significant increase range of motion and decrease of pain after the first treatment. And then it's a cumulative treatment. So there is protocols like anything. There's nothing that's one time, one and done. But the patient does know it. So it makes it a lot easier for being a cash modality treatment to get the patient to understand the technology, how it works, and know that they're actually getting that specific injured area treated, as opposed to, like you mentioned, if trust me, go home, it's going to feel better. There's a lot of modalities out there like that, and they do work. It just, they work a little bit slower, and they're not getting that immediate relief. So with ours, it definitely, lets them know that we're working on that specific injured site. And same thing with sports teams. A lot of sports teams, college teams specifically, Division I teams, when they treat their athletes, they use it as a BS detector. If the athlete comes in and says, "Hey, I'm hurt, I can't practice today," they'll scan over the tissue with the PiezoWave, and if they don't see a wincing or a facial expression, they usually know that the athlete's not in the pain that they tell they are, and they put them back out of practice. So they use it as a diagnostic BS detector as well. So yeah, that's
we should start doing that. That is crazy, because there's no lying from the acoustic sound wave therapy. If you're on an area that hurts, like I've had some pretty big bodybuilder guys that are patients come in and they're like, "Oh, turn it up, doc," whatever. You're like, "No, I'm not going to." No, I'm tough. You're like, it's not about being tough. It's about the injury and the extent of the injury. And that's funny. So maybe we can. I need to get Dr. Natalie in here, because she would have some fun with that. Say, "Hey, how hurt are you?" Maybe we could, collaborate with some athletic trainers. Say, "Hey, if your athlete thinks they're better, let them come in here," because we always, as athletes, we want to get out there as soon as possible. And that's kind of what led me to the injuries I've had, is I went back too soon. And so we gotta respect the injury, treat the injury effectively and appropriately. But I want to really dive into this, and let's talk about chronic pain for a second, because chronic pain affects over 100 million Americans every single day. We have the opioid crisis, we have the opioid epidemics, and chronic pain is not going away, and we know it's multifactorial. But how does this type of therapy reset the chronic pain cycle. Can you talk about how it does that on the cellular level?
Absolutely. So with our device, the another large benefit is you can use our device to treat both chronic and acute injuries. So the traditional shockwave, which is the radial we mentioned in the beginning, you can't use it on acute injuries, and you're not going to use it over bones, plates, pins, screws, fractures. With ours, you can use it over any hardware. You can absolutely use it over plates, pin, screws, bone fractures, stress fractures. You can use it over those because it's only affecting that injured tissue. So with that being said, the chronic issue is generally is the a path of pain, nerve pain through the nororeceptors. They're sending the signal. You need to break that path to get them to reset. And generally, you have to do a little bit more of aggressive treatment. Up to 2 to 3 treatments a week for a couple weeks to get it to a manageable acute phase, and then you can obviously get it to that dispersing to where it's actually going away. And then at that point it may be 6-month maintenance. It may not even require maintenance. It just depends, and everybody's different. The protocols generally are 2 treatments a week for 4, possibly 6 weeks. It just depends on the patient and their outcomes, their habits. People are creatures of habits, so they tend to go right back to where they're going, especially runners, plantar fasciitis. It's very, I've probably 2 dozen athletic trainers and massage therapists that have treated and physical therapists that treated people with plantar fasciitis that haven't ran in a year. After one treatment, they were running that night. And then obviously you got to keep up with that protocol to get them better. But it's pretty significant in some cases. Even carpal tunnel, after one treatment, pain's gone. So it just is a little bit different for each person. But you got to get them bought into the protocol, just like it is. I tell a lot of my clinicians that you got to explain to your patients, like, if you get sick, you get a cold, they give you a Z-Pack. The first 2 days you take it, you start feeling great, but you got to see the whole 5 days out to get rid of it. Same thing with this. After a couple of weeks or a couple of treatments, you're going to feel better, like and think you don't need it, but you need to see the whole protocol out. And in doing that, you're getting rid of that impinged tissue that's causing this pain, and get it from the chronic to the acute phase and then gone.
I love that. Yeah, because so many people get stuck in that chronic pain trap. It's ongoing. It's debilitating. It starts affecting your mood, your sleep, your anxiety, your stress. And if you can, we're telling our patients we're going from a chronic injury to an acute injury, but in a controlled fashion. So we're basically making this injury think that it just got injured, and when that happens, it's releasing growth factors, macrophages, interleukins, stem cells, right? So that's a big thing. Is if your body's still young enough to produce stem cells, you can actually promote, new stem cells to come and new chronocytes to come to areas, and regeneration happens. So that's kind of the cool thing, is that if you're stuck in this pain cycle and you're not healing, maybe you've gone NSAIDs, which we know can actually block part of the chondroitin cycle where you don't produce it anymore. So it's such a unique therapy to stop that cycle and get people on the path of healing. And so with that said, I know stem cells is a very, very hot topic, and I know you see or you visit and serve practitioners that do stem cells. But what about just the shockwave or the acoustic sound wave therapy on its own producing stem cells? What is the current data showing? What is the research showing? And what are your thoughts on that?
Yeah, for sure. That's another large, quickly growing market for us is the regenerative medicine side. So we have quite a few clinicians that are doing a lot of regenerative medicine in conjunction with the acoustic compression therapy. What they're doing is they're finding that they're priming the tissue, doing a few treatments a week or 2 in advance before they do the injections. One of our really clinical, reputable spokespeople for our company, and it's all on his preference to do it and help is a gentleman named Dr. Tom Hecker. He's based out of Fort Collins. He's a non-surgical podiatrist, and he's actually does a lot of regenerative medicine with exosomes, actually Chimera Labs exosomes specifically. And he finds, that he's doing treatments before prepping the tissue because it does increase growth factors, oxygenates the blood in that area, gets some healthy oxygenated blood in there. And then they're finding that the tissue is actually, the injection is taking better into the tissue when they're prepping it and getting those natural growth factors up. And they're finding, in a lot of instances, same with, as I mentioned, with even stress fractures, treating over those stress fracture areas, you're breaking up those osteocytes, and it's increasing the growth factors back in the bone and the tissue to help them regenerate naturally. So, what you're really doing is getting the body to do what it's supposed to and heal itself, but it's giving it a little nudge to move a little bit more quickly than just regularly standing there stagnant with the blood not flowing, not increasing oxygenated blood in there, and keeping that pooled unhealthy blood in there.
Yeah, so Dr. Hecker, you introduced me to him. I spoke with him at length on the phone, and I also had some issues with my ankle, and he gave me like an extensive protocol with exosomes, how to use acoustic sound wave therapy together. And basically it went something like this. I'll probably butcher it, but it was, hey, once you get the injection, maybe it's a stem cell injection, maybe it's an exosome, PRP, whatever, use the acoustic sound wave, PiezoWave, to stimulate the areas that you want it to go to. Because when you're introducing something that's not natural to the body, your growth factors, et cetera, they need to know where to go. Otherwise, they're going to go where they want to. So if you have direct pressure going to an area, say, hey, this is the area that we need to focus on. This is the area that I want you to bring growth factors to. It can, just bring those growth factors up. But of course, there's a lot of things in the healing cascade. If you're not taking care of your body, if you're not eating right, if you're not exercising, if you're not getting healthy blood flow to begin with, and you use this modality, your outcomes are going to be similar to if you just, did soft tissue therapy or something else. But I think when you're having it working for you, they all work hand in hand. And we're excited about this therapy because we have this in our office, and we've seen great success with the tough patients, right? With the collagen issue patients, like the Achilles tendinopathy patients, plantar fasciitis, quad tendinopathies, lots of different things. But as far as, all the common ones, tritinocell was another common one. What are some uncommon clinical applications that you've seen? And I remember, and before I get all backtracked, there was a really cool picture that you shared with me about the fracture. It was the non-union healing fracture, and then it was like pre and post shockwave treatment or acoustic sound wave therapy. It was like night and day difference in how much healing had occurred with the acoustic sound wave therapy. That was awesome.
Yeah, it's pretty significant. Just the research on how well it can help the body heal itself naturally, like you said, with the cascade of healing effects. Just pulling everything to that area to get it actually regenerating naturally. Everything from we find from plantar fasciitis to TMJ, you can do treatments, and there's research out there. A lot of off-label stuff that's coming out of Germany that you'll be seeing in the next few years. That's showing everything from treating dementia to wound healing, open diabetic neuropathy wounds and ulcers, treating them and actually getting some pretty significant results. Another really large off-label market, completely off-label, is the men's health, the ED side, for increasing blood flow, breaking up any kind of scar tissue from Peyronie's to calcification and plaque buildup. So there's a lot of off-label use that the U.S. isn't recognizing yet, but you probably be seeing pretty soon, sooner than later, here in the U.S. thinking outside the box for treatments. It really is exciting to see what's going to be coming in the next couple of years and what they're going to be using it for.
And that's because it works, right? If it didn't work, you wouldn't see all these trials being done.
Yep.
People wouldn't waste time on it. But yes, ED, that's got a huge success rate. And obviously we don't do that, but the studies are showing that. We don't do that as chiropractors, but I know a lot of MDs are doing that in their sexual wellness practices. But you mentioned two other conditions I wasn't aware of, TMJ and also dementia. How do they do that for dementia? Is it a certain area on the brain? you stimulate, or
a different it's the same technology, different manufacturer of it. It's a lot more sophisticated. They're using, if you can look it up online. They're using a halo to actually deliver these sound waves, and they're using a real time CAT scan to see what brain cells are not stimulated, to get them stimulated with acoustic waves. And like I said, there's nothing in the U.S. for it. It's all been done in Germany and continuing to be researched. But it's just exciting to kind of look and see what's out there and what's going to be coming our way, and what they're recognizing more research for. But there's the TMJ is another application that's a really good success rate. Any kind of tendinopathies, bursitis, calcification, any kind of like I said, stress fractures, repetitive strains. Really good results with shoulder calcification, pre and post surgical. You can really start treating somebody within a week or two after their surgery, as sutures are removed. And it does get some pretty significant results in the healing factor after post surgeries. We have some really, really big clinical references from John Hopkins outpatient rehab in Baltimore. They have about 6 of our devices. Dr. James Andrews, the Andrews Institute out of Birmingham, his PT uses it. Kevin Wilkes, he uses it in his seminars. If you look at any of his social media posts, you can generally see our device in the background of Kevin Wilkes.
That's awesome.
Rehab with all these pro athletes. He deals with the most high level athletes. And then West Coast, we have Dr. Coe that's on the West Coast that has a really nice rehab facility. He does a lot of seminars and stuff. He uses our device as well. So we're across the board with about 40 going on 40 plus pro teams between professional sports teams and Division I elite teams from LSU, Clemson, FSU. And then all across the board with sports teams. Majority of them are in the NBA to the NFL, like Tampa Bay Buccaneers. They have 2 of our devices.
Tampa Bay has 2?
Yeah, they have 2 of them. Bobby Slater's their athletic trainer. He's a big component. He loves our device, and he doesn't use modalities. He's quoted, and he's told us to repurpose it many times, that he's not a modality guy, but he sees significant results. He was the one that actually informed me how well that it works on stress fractures. But they got 2 of them, and then everybody from the Buffalo Bills, the New England Patriots chiropractor, he's been with their team for 30 years. Dr. Michael Miller, he uses it, and it's all across the NHL and NBA and NFL, and you're located in Texas. We got the Houston Rockets and the Texas Rangers. They both have them over there.
Wow, that is so. And Dr. Andrews, that was the surgeon who did Drew Brees' shoulder surgery. Yeah,
Drew Brees' surgery. And he also did Tua Tagovailoa, the quarterback for the Dolphins that broke his hip in Alabama. He did his surgery. Kevin Wilkes did his rehab as well.
Wow. So Bobby Slater for Tampa Bay Bucks, Super Bowl champs, are using this for their athletes. It makes sense for any athlete to get the best out of their bodies to use what the pros are doing. And if 40 pro teams are doing it, it's going to be for a reason, right? Pro teams don't just jump on something that's not clinically validated, that's not getting results, because when you're playing a sport at that high of a level, it's a money sport, right? And you need your body is producing money, and you need to get that body in as tip-top shape as possible. So that is cool. That is super cool. So 40 NFL, you said 40 total teams right now? Yeah,
between 40 teams between professional sports and Division I sports teams, like intercollegiate teams, like I said, LSU and FSU and Clemson. It's a little over 40 combined.
So can you get the Dallas Cowboys to get one of these and get my players better so we can start winning some games, please?
Yeah, I've been working on that. We could use it on Dak Prescott.
Maybe Texas. Maybe the Texas Longhorns as well. So yeah. Dak might be getting it. I don't know. One of my colleagues, I know treats him routinely. So
I believe, cool. And he does have it in his location as well. So I'm sure he he'd be introducing it to him after.
I'm sure he's getting some therapy, which is what we need.
Yeah,
Which is what we
absolutely.
need. So yeah, for anyone who has no idea what we're talking about, they're like, Shockwave, what is that? And then they go Google it and they find some imitation Shockwave product. Can you tell, like, obviously this machine is big. It's a tower that we have in our clinic, and that's what the pro teams have in their offices. But there's these little portable units, and why do people even call it Shockwave, John? What's the deal? It's just because someone's working, they're trying to copy it?
Yeah, so there's like anything out there, there's always going to be an imitation. There's always going to be a cheaper knockoff, Chinese version. For to be honest, that's where a lot of these the knockoffs are coming in there. If you Google Shockwave, you're going to find everything from $300 all the way up to $75,000. And the reason why is obviously they're knocking these things off, but they're by no means as effective, as powerful, as durable as the actual reputable companies. There's only really in the actual Shockwave market, there's our product, the PiezoWave, and then the other reputable that most chiropractors have heard of is Storts. Those are the leaders in the Shockwave industry, and then there's obviously some subsidiaries where people are repurposing or white labeling machines, and then the ones that you're seeing online that are maybe $300 are really a high power, like a massager, the same as you get if you're getting a Hyper Ice or Hyper Volt. They're no way in shape or form penetrating into the tissue, the depths and the location as our device and even some of the other Shockwave devices on the market. So that's one of the reasons why we really stay away from the words Shockwave. We coined the phrase myofascial acoustic compression therapy, MyACT. And we kind of stick with that because it really is acoustic sound wave therapy. It's acoustic pressure going into the tissue to actually penetrate and locate this functional tissue. And the other devices, they're just really just surface level is the most delivery of sound waves. So it's not getting the depth and the location and precision of the tissue.
Right. It's probably a good thing that those other knockoff machines aren't going as deep, because those aren't, clinicians applying it. They're just going to do whatever they think is right. Maybe they'll hurt themselves even more or cause more tissue damage than they're supposed to. So yes, I love that the machine is, for clinicians. You can't really find it unless you're at a clinician's office. What I want to talk about now is let's go back. Sorry, I'm going all over the place. Ultrasound. So that's a lot of the modalities that I used to do. It's kind of a passive modality. Can you talk about the difference for people between this and acoustic sound wave therapy? Because they kind of seem similar. You're using the gel, but the clinical applications is a lot different.
Absolutely. So yeah, that's a very common question I get when I explain it's acoustic compression therapy, the diagnostic phase. How you doing? And it is significantly different. And the way it's different is with ultrasound's delivering thousands of sound waves into the tissue, causing the tissue to rub together at a high rate, which is causing friction. That's the thermal side of it. With our device, it's using up to 8 pulses per second, causing the tissue to bang together. As it's banging together, it's causing mechanotransduction, waking these cells up and getting these cells activated at the cellular level, in the actual in the cells themselves. So it doesn't cause any thermal energy delivered into the tissue, doesn't cause any electrical energy delivered in the tissue. It's all just the sound waves causing the actual cells, the mitochondria of the cells to actually start working again. So it has the diagnostic capabilities by sending the sound waves in and applying pressure to those fibrous dysfunctional tissue. And that is a pretty common question that I get, is how it's different from ultrasound. And I'll be truthful, about probably 80% of our clinicians will have ultrasound that they're not really using after they do implement in the PiezoWave, because it is different. You're still getting significant results without that worry of injury or burning of the tissue.
Right. I think we just learned ultrasound a long time ago, and we weren't really introduced to this new technology. So that's kind of why we still have this in the office. But I have Dr. Natalie here. I wanted her to kind of chat with you because she's seen phenomenal results and she's treating, way more patients than I am. And I wanted her to just kind of quickly go over some of the injuries she's seeing, some of the results she's seeing. Put her on the spot here. But we like to talk to John too often, so got to take advantage of it.
Hey, John, how are you?
Good. How you doing?
I'm good. Cold, but we're good.
Yeah. Sorry to hear that. You guys have been going through some crazy weather.
Yeah, but we got electricity and water today, so we're much better now. Yeah.
Good.
So what did you want me to talk about?
Just talk about some of your best patients, results wise.
So definitely seeing really good results with anything like lower leg, foot, any of those type of issues. Achilles tendonitis seems to respond really well. I've treated several Morton's neuromas, plantar fasciitis. What else have we? Oh, a lot of good like hand, wrist, arthritic thumbs. Yeah, so I've really enjoyed working with the machine so far and seen some nice results. Prior to having it, our kind of standard was just some soft tissue and rehab exercise for a normal soft tissue injury. And a lot of the ones that tend to take longer with that model are responding the best to the PiezoWave.
Yeah, that's one of the things you'll find too is there's multiple applications. Any soft tissue pain or strain you can treat. It's really a modality that's extremely safe and with very few contraindications. And it's a modality that allows you to think outside the box and actually treat some issues you would never be able to treat, from certain extremity issues to be able to get in behind bone to treat inside of behind patella tendonitis to inside fingers to treat everything from trigger finger to arthritis. And it is pretty significant the relief that they'll get after just a treatment or two. And it really does see some pretty amazing results with just applications that you wouldn't normally be addressing. So we get excited about it too as well, and hearing the stories of successful breaking up scar tissue to bursitis, sacks, things like that.
A lot of people, once they get off the table, they'll feel like that instant just relief walking out. They're like, can you come home with me and do this more?
Yeah, a lot of people don't realize that where their pain's coming from, and a lot of times just if they're taking medication or they're not doing anything, that pain's still there. It's not going anywhere. It may be relieved by medication, or it may be relieved by just relaxing, but it's not going away unless if you actually find that injured tissue, address it and treat it, soften it up, get rid of it, make it more pliable to get out, to disperse it out of that tissue, so the healthy tissue can start to regenerate in the actual form and fashion it's supposed to. That's one of the educational parts of speaking with the patients and explaining, you have impinged tissue. This tissue right here is what's causing your discomfort. We need to get that addressed, to get rid of that, and then your body's going to heal back naturally, and that's where you have a better quality of life and get back to your normal activities. It's just really about getting them bought into the actual protocol and sticking with it, and and adhering to what your suggestions are and your treatment is.
Yeah. I recently had phenomenal results on a boxer who he elected to not have any imaging done, but pretty sure there's probably some sort of fracture on his knuckle. And when he came in, I told him, we'll treat the soft tissue and see what we can do. But it looked like he just had one giant knuckle that went across the entire hand because it was so swollen. And by visit 2 or 3, you could see definition between each knuckle. His pain level was significantly reduced, and he was feeling a ton better. And he had been dealing with that for a few weeks prior with no relief from your basic, just like rest, ice, etc. So that was cool to see. That was one of the more recent ones that
yeah, that's the thing that's good about it is, there's, for anybody that would be listening, is there's two different techniques that really you use commonly is, the hovering, stopping and hovering over the tissue once you find that dull, achy feeling that they were speaking about earlier. Hovering over it, softening it up, getting it more pliable and getting rid of it. And then another technique is the wanding, volumizing, increasing blood flow in that area, but wanding where you're slow, steadily moving across. So any kind of edema, any kind of inflammation, swelling in those areas, a wanding fashion is a good suggestion to do that, to kind of get that inflammation to break up, to move out of that area.
It seemed to clear it out pretty quickly doing it that way. And I really like the diagnostic effect of the machine too, because obviously like his complaint was that his knuckle, but as we were working, I found a lot going on up higher towards the wrist. And once we were able to kind of clear that out, he started feeling a ton better. So the machine pretty much told me to do that just based on, scanning the area and seeing what I was finding. Otherwise, I don't know that I would have necessarily addressed the wrist as thoroughly as we did. But it was pretty cool.
Yeah, that's a good thing is, if you scan around, you're going to probably find on most people, you're going to find some dysfunctional tissue, some pain that they may not be feeling, or if you're addressing it, even if you're palpating around the area, they may not feel it until you go pass over it with the PiezoWave. It'll locate dysfunctional tissue. It'll locate pain that they may not be having now, but eventually will. Or if they're not feeling it there from just from applying pressure to it, then it's a referral pain or radiating pain, and it allows you to kind of think out of the box, get creative, and scan around to find out where that actual injury or that pain and localized is coming from. And that's one of the things we always suggest to spend a little bit of time. It's a modality that's very hands-on, a very biomechanical feedback from the patient. You got to communicate with them to get them to tell you what they're feeling. And when you do, you get them trained to it. They're gonna offer all the information you need to get them better. And the good thing is, you explain to them that this is a good pain. It's a very tolerable pain, but it's a good pain, and then it's going to come with good results.
Have you read any recent research about kind of supporting the PiezoWave with like a small tear in a disc?
Yeah, so there is research for the helping tears, minor tears, especially in discs, herniated discs, as well as in ligament tears and insertion points. So as we were mentioning earlier, it's really causing the pressure or the fluid that's forming around these tears to disperse, but also increasing the oxygenated blood in that area, increasing the growth factor in that area to help heal it. But it's a lot of times what it's doing is taking that pressure off by removing that impinged tissue from that area and allowing it to regenerate in that area.
And based on the research, how long does it tend to seem to take?
So a lot of times they'll find, we've had some clinicians that have done a lot of extensive research on their patients alone, and they'll generally, suggest 2 treatments a week, 4 weeks, up to 6 weeks. And they find that at about technically about the fourth week mark after their last treatment is when the patient feels their most optimal or the healthiest. So there is that residual healing effect that takes place after each treatment, and it's generally after the suggested protocol of 2 treatments a week, 4 weeks. It's a good 3 to 4 weeks after that the patient actually feels that they could be potentially at 100% healed or at normal activities.
Great. Oh, cool. Yeah.
Awesome.
Here's Robert's back, so taking me out.
Sorry, we're all at home with this this winter shelter in place, so it's kind of chaotic.
I understand.
All patients have been rescheduled. We're not used to it, so it's the power demand, and we just got water back today, so we will always remember this. So Yeah, I'm sure we're going to get a wide mix that are listening to this, and so I want to address both. So for the patients, for people who are needing acoustic sound wave therapy in their lives, where can people find a clinic near them? Obviously, if they're in Georgetown, we have the modality. If they're happy to we're happy to use it on them. But where can they find providers or websites to look up where people have such a modality in their office?
So we don't have a specific clinician locator on our website, and that's for a purpose. Unfortunately, with every market, especially ours, it's a competitive market. So you find that a lot of other competitors are going on our sites and trying to reach out to our customers, and so we don't have a specific locator, but you can find we're pretty much going to have somebody in major metropolitan areas. But on our social media outlets, Elevation USA, we have Instagram, we have Facebook. We also have podcasts, YouTube videos, and a lot of times we're highlighting clinicians in different areas that are using it and getting some success. So it's a lot of just regular social marketing. And we're a really, really big referral modality for not only the clinicians to clinician, but also from clinician to patients, and patients to family members and friends. So it's pretty spread out. We're still in the infantile stages, about 7 years into the U.S. market, and we're still getting product knowledge out there. But we do have clinicians. The best route to find a clinician that would have the PiezoWave, it would be in the chiropractic market, or even if you're Googling it, you can Google PiezoWave or MyACT, and generally there's somebody will pop up that's marketing those products.
So yes, if a patient was wondering where to find this, could they message maybe the social media manager on Instagram where to find Elevation Medical? Is that the handle? I can't remember.
Yeah, Elevation Medical, Elevation USA, Elevation Medical USA, and they can go on the website and send in an inquiry on there. And our corporate office, we're not a huge Fortune 500 company. We're very small, so we'll be very quick to respond and very hands on. But they can message or send an email to our corporate office, and they'll direct us to somebody in that region. Like myself, I'm in the Southeast sales manager, so I cover Texas, Kansas, all the way heading east in the South. I don't cover Georgia and Carolinas. Our VP does. He's in Duluth, Georgia, and then I cover New York. And so they'll send the information to that rep in that area. That rep will reach out. Even if it's a patient, we're going to send you to a clinician that may be in your area or close to your area to help you get the treatment you need.
Got it. So if you're a practitioner listening and you want more information on the PiezoWave 2, where can clinician find out more information? Where can they find you too, specifically, John?
Yeah, so they can go to our website. Elevation USA is our website. That's going to be the best bet for finding most of your information for us, but also you can send your inquiries through there, and then they get routed to us, to the reps specifically. And then we're, like I said, I mentioned we're on Instagram and Facebook, also YouTube, and on podcasts. We have a podcast that's called The Recovery Lab, and that touches on our device, but also it actually covers a lot of rehab specialists that do and do not have our product, but they have a lot of knowledge that they contribute. But most of the clinicians that are on there are high level sports rehab clinicians and do use PiezoWave. Myself personally, on LinkedIn, I do a lot of stuff on LinkedIn and Instagram as well. Just my first and last name, John Cancelino. You can locate me, and I can even get you in contact with the rep or a clinician in that area. I can search our internal database to find out who's in the area and get you linked up, because that's one of the benefits of working with us specifically, but also being a smaller company. We help both the patient and the clinician and make sure that they're matched up to get the best outcomes for both of them.
Awesome. Well, you've been such a help to me and Natalie when we opened up our new clinic a few months ago. So We really appreciate all your insight, all your knowledge, and how eager and quick you are to answer any questions that we have, any patient types that are a little bit difficult, complicated. So we appreciate it, John. And anyone listening, find John on LinkedIn, connect with him if you're a clinician, if you're a patient. Follow Elevation Medical on Instagram. I think you can search the hashtag PiezoWave2, and you'll find them. You'll find them somewhere. They post a lot of good information. They even repost some of our stuff, so we're so thankful for that as well. But John, it's been a pleasure chatting with you today. Anything else you want to share or add with anybody?
No, that's about it. I appreciate you guys for having me on here and give me a chance to, go over the technology, how it works, and some of the benefits of it. And look forward to anybody with any future questions, or if they have just some additional information, or even if you have the device and you want to give some feedback. We love to hear it. We're very hands-on with our customers, and we love to help and get people better. That's at the end of the day, we're here to help patients feel better, and so are you as a clinician. So we'll do all we can to support you.
Awesome, John. It's been a pleasure. Hope you have a great day. Hope you're enjoying the nice summer weather over there in Florida.
It's a rough 80 degrees. I'm sorry to hear that.
Gosh, we're freezing our butts off. Can't even leave. So,
yeah,
awesome. John, thanks again.
Thank you, guys. Good talking to you. Take care.